Schizophrenia is a mental health disorder that affects how a person thinks, feels, and behaves. Symptoms can be a little different for everyone, but include positive symptoms of hallucinations, delusions, and disorganized thoughts. Hallucinations are when a person experiences something that isn't really happening. This can be hearing, seeing, feeling, or even smelling things that aren't there. The most common type of hallucination is auditory, or hearing voices that no one else can hear. The voices are often negative, critical, or annoying. Delusions are when a person believes things that aren't true. They become certain that something is happening that other people see as false or strange. This can be paranoid delusions, beliefs that you're being followed, harassed, or in danger. Other types of delusions can be believing that you're getting special messages or communications, or finding special meaning in ordinary events. Some people with schizophrenia may believe that their thoughts aren't their own, or that they're being controlled by someone or something. Schizophrenia causes disorganized thinking, which is noticed most in how the person talks. They may have a difficult time with concentration, jump quickly from subject to subject, and say things that don't quite make sense, like puzzle pieces that don't really fit together. Behaviors also become disorganized. The person may start acting in unpredictable ways, becoming easily agitated, or begin repeating phrases or movements over and over. Negative symptoms are things that aren't there but should be. This includes a flat affect, a decreased emotional expression, and decreased motivation or not feeling energy to do anything. People with schizophrenia often start to isolate or spend more and more time alone, and they neglect to care for themselves with activities like bathing and changing clothes. Symptoms start sometime between the late teenage years through the early 30s. Schizophrenia is believed to be caused by a combination of brain chemistry, genetics, and environmental exposures. It can be worsened by stress, not getting enough sleep, drugs, and excessive alcohol use. Treatment includes medications called antipsychotics or neuroleptics and certain therapies such as cognitive behavioral therapy. Delaying or avoiding treatment increases the risk of suicide and can cause psychotic symptoms to become harder to control, as well as cause irreversible changes to brain structure and function. Sadly, there's a lot of negative stigma surrounding the diagnosis of schizophrenia and inaccurate ideas about the illness. People with schizophrenia do not have multiple personalities, and they are not more dangerous than other people. In fact, people with schizophrenia are more likely to be the victims of violence by others. Together, we can work to educate ourselves, our families, and our communities about schizophrenia and help those affected live long, satisfying, and productive lives.